Good day. My name is Jeffrey Samet. I'm a primary care physician and a professor at Boston University and Boston Medical Center. I'm going to address today alcohol use. So I'm going to start with a favorite painting of mine, just to remind us that this is not a new issue. Alcohol use has been around for millennia. People sometimes say, well, I use alcohol. Is that a problem? So having some understanding of, well, when is the use of alcohol a problem? What are risky amounts of alcohol that I might use? And in fact, there are established risky amounts for alcohol use. That's based on the quantity and the frequency, whether you're a man or a woman, and your age. And so these are the criteria for risky alcohol use, and I'll tell you how they came about. So for men less than or equal 65 years, having more than 14 drinks in a week, or more than 4 drinks on one occasion is considered risky alcohol use. For a woman and for men older than 65, more than 7 drinks per week or more than 3 drinks per occasion is risky alcohol use. So it depends on your age and it depends on your gender and then how much you drink. It also depends on what you're calling a drink. So we're talking about standard drinks here. This pyramid is very helpful for thinking about alcohol use in general. And you go to the bottom, and the message here is that, in truth, a large minority of people, adults in the US, don't drink alcohol at all. So not drinking is normative behavior. And then another sizable group drink at low risk amounts, and that's normative behavior. And so that's no problem, that's fine. Alcohol use becomes unhealthy when you move into the risky use category, or even more severe, the alcohol use disorder category. So risky use, we talked about, depends on how much you drink and man, woman, age. Alcohol use disorder is more than quantity, frequency, and some demographics. And we'll share that with you. What you can see, which is, in fact, what happens, is on the right side, as your consumption goes up, consequences go up as well. So heavy, frequent consumption leads to many and severe consequences. This gives you an understanding of what a standard drink is. A 12-ounce beer, a glass of table wine, a jigger of brandy or spirits. Those are all drinks. Not a huge New Orleans-sized Bourbon Street drink. That's more than a standard drink. Okay, so in the unhealthy alcohol use range, you say, well, when am I risky drinking and when do I move to this more severe condition that's called an alcohol use disorder? And there are 11 criteria, and we'll walk through them so you can think about for yourself or your friend or family or loved one. There are 2 criteria that look at physiological issues. One is tolerance, and tolerance is when someone needs to drink more to get the same buzz that they got in previous times. Or they get the same buzz, but it requires them drinking more and more. Withdrawal is not feeling right when you stop drinking alcohol. Sometimes people call it the shakes. Sometimes they get anxious. Sometimes their skin feels like it's crawling on them. but there's a whole set of symptoms that go with withdrawal. But having either tolerance or withdrawal will give you two of the criteria of alcohol use disorder. Three other criteria deal with loss of control: drinking larger amounts and for longer periods than you had originally intended, or not being able to cut down or control your use. I planned to go out and have 2 drinks in the evening and I had 2 6-packs. Or increased time spent obtaining, using, or recovering from your alcohol use. Those are all criteria that fall into the loss of control. Craving is when I just really want to drink. I just need a drink. That's craving, another criteria. And continued use despite negative consequences. I'm screwing up at work, they're mad at me at home, or I'm failing at school when I used to do well. Those are role failures. Social and personal problems, the relationships are going down the tubes, or you're having problems in that sphere. Reducing social work, recreational activities. I used to go out and play with the softball team, but now I kind of head to the bar first and I don't do that anymore. Physical hazards, the classic is driving while under the influence, driving while drinking. That's a physical hazard. And physiological or physical harm. So medical problems that are a consequence. My liver is sick. My stomach's upset. My blood pressure is high because of the drinking. So these are all criteria that when you add them up can give you mild, moderate, or severe alcohol use disorder, depending on how many criteria are present for the individual being considered. And for people who have unhealthy alcohol use or alcohol use disorder, recognize that they will be in different stages of readiness about their behavior change. If you want to talk to them about their behavior change, well, they may not even think it's a problem. That's them being in a pre-contemplation stage, no intention of changing behavior. Whereas some people are aware of the problem, but not ready to do something about it. And they're kind of ambivalent. It's a problem, but it's not really a problem. They can move from contemplation to preparation, where they're intent on taking some action, but they haven't taken any action yet to address that behavior, to being in the action phase, where they're actually actively trying to modify the behavior, to maintaining that modified behavior. To recognize with any behavior change, and it certainly applies to alcohol, that relapse is always a possibility. Know too that when you're in the unhealthy alcohol use range, there's sort of 2 recommendations that can be considered. Cutting down what you're drinking. If you're risky drinking, but you haven't had any of those complications that we talked about for alcohol use disorder yet, or certainly not more than a couple, the idea of thinking about just cutting down your risky drinking to safer levels is a reasonable recommendation. But if you're more severe than that, or you've failed at cutting down repeated times in the past, or you meet criteria for moderate or severe alcohol use disorder, or you're pregnant, or you're thinking about getting pregnant if you're a woman, those are all times you want to stop drinking completely. Maybe when you have a medical condition or on a medication that alcohol just won't work with, you want to stop completely. "12-step programs is something else to know. 12-step programs can be quite helpful for individuals who have an alcohol use disorder and want to stop drinking. Be aware that the focus at these meetings is on abstinence. They advocate lifelong participation, and that is an emphasis. There's sponsors that are at the meeting that can help the individual. And remarkably, this is a very helpful approach to addressing one's alcohol problem for some people, and it's free. All you need is a willingness to cut down your alcohol use. And be aware as well that there are FDA approved medications to address alcohol use disorder. I won't go into details about them, but disulfiram, acamprosate, and naltrexone are 3 FDA approved medications that help address alcohol problems. Finally, I would just say that although there are 3 medications, they don't seem to be of additional benefit if you use more than one at the same time. And just to know, recognize how common mental health problems are comorbid with alcohol problems. So they'll both exist at the same time. And although antidepressants don't work for alcohol problems specifically, if the individual is depressed and drinking alcohol, treating that depression with antidepressants can benefit their alcohol use problems. So I hope you've gained some insight into alcohol use and when it's unhealthy and how one can address it. Thank you.